Stop scrolling, CBD just changed cat mobility. As a veterinarian deeply committed to enhancing the lives of our beloved animal companions, I am constantly on the lookout for safe and effective ways to improve their well-being, especially as they enter their golden years. That is why I was so encouraged to see the recent publication of a new study that offers a ray of hope for cats struggling with mobility issues. The research, published in the prestigious Journal of Feline Medicine and Surgery, details the successful use of a specific CBD and CBDA formulation. The study, sponsored by Vet Sciences, suggests that their unique hemp paste significantly helped cats move with greater ease and comfort, marking a pivotal moment in our approach to feline joint health and chronic discomfort. This news is particularly significant because our feline friends are masters at hiding their pain, a survival instinct inherited from their wild ancestors. An owner might only notice subtle changes, like a reluctance to jump onto a favorite windowsill or a bit of stiffness after a nap. For years, our options for managing this type of age-related decline have been limited, and some traditional medications come with a risk of side effects, especially with long-term use. The potential for a plant-based compound like cannabidiol, CBD, to offer relief without serious adverse effects is something the veterinary community has been watching with keen interest. This study provides the first piece of strong, peer-reviewed evidence specifically for cats in this critical area. The product at the heart of the research is not just any over-the-counter CBD oil. It is a specific paste rich in both cannabidiol and its raw form, cannabidiolic acid, CBDA. This combination is thought to have a powerful, synergistic effect, working together to reduce inflammation and modulate pain signals more effectively than either compound alone. The study aimed to rigorously test this hypothesis, moving beyond anecdotal owner reports to the hard data veterinarians rely on. To truly appreciate the importance of these findings, it is essential to understand the meticulous design of the study. The researchers employed what is considered the gold standard randomized, double-blind, placebo-controlled crossover. This sophisticated approach is designed to eliminate bias and ensure reliability. Randomized means the cats were assigned by chance to either receive the active CBD plus CBDA paste or an identical-looking placebo paste with no active ingredients. This prevents selection bias and keeps groups comparable. The double-blind component is equally crucial. Neither the cat owners nor the veterinarians knew which treatment each cat was receiving. Cats were observed and scored on mobility without anyone knowing the assignment, making the reported changes much more credible. When the data was unblinded and analyzed, the results were clear and statistically significant for the cats who completed the study protocol. The cats, while receiving the active CBD and CBDA paste, showed marked improvements in their mobility, noted by their owners and the assessing veterinarians. This dual confirmation is incredibly valuable. It shows benefits were not just subjective feelings but clinical improvements. The study documented significant enhancements in the cat's gait, meaning they walked more smoothly and with less hesitation. Many owners reported better ability to navigate stairs often impacted by hips, back, and shoulders. Positive changes in jumping behavior stood out as well. Cats are vertical by nature, and regaining that freedom matters. An increase in play behavior was noted, a heartwarming sign of improved comfort. While the efficacy results are exciting, any responsible veterinarian asks, is it safe? This mobility study monitored adverse effects and found the CBD plus CBDA paste well tolerated over 6 weeks. This aligns with growing evidence that THC-free CBD, used appropriately, has a good safety profile in cats. The absence of major side effects in a controlled trial is reassuring, but 6 weeks cannot tell us about many months or years. Cats metabolize substances differently than dogs and humans. A 2024 Frontiers analysis notes long-term suitability data in cats remains limited compared to dogs. One Frontiers study evaluated daily THC-free CBD in healthy adult cats over 26 weeks, 6 months, with very positive tolerance. Healthy cats responded well. No lasting health issues were reported. We still need data in cats with pre-existing conditions, especially liver and kidney disease. The key takeaway is cautious optimism with a vet-led approach. Work with your veterinarian to monitor and avoid drug interactions. Ongoing vigilance and professional guidance are non-negotiable. The Elevet Mobility Study does not exist in a vacuum. It is part of a small but growing field dedicated to understanding how CBD affects our feline companions. For years, cats were overlooked, with most work in humans and then dogs. As CBD Vets AU highlighted in December 2024, feline clinical trials are still in their infancy, but the past year shows a surge in high-quality studies. Foundational work focused on pharmacokinetics, how cats absorb, process, and eliminate CBD to help determine proper, safe dosing. Other studies explore anxiety and stress. Early signals are promising, but evidence is not yet as robust as what we now have for mobility. Compelling canine data on pain, inflammation, and mobility helped pave the way, and this feline mobility study confirms meaningful crossover potential. Still, this is one successful trial with one product, a strong foundation upon which science must keep building. Scientific interest is rising alongside massive consumer demand. GM Insights values the cannabidiol pet market at over $693 million in 2023, with strong growth projected. Rising pet ownership and wellness-minded care fuel interest, especially for mobility. But a crowded, variably regulated marketplace makes quality verification essential. Peer-reviewed studies help differentiate evidence-based products from hype. If your cat is slowing down, hesitating to jump, stiff after naps, schedule an appointment with your veterinarian first. Do not self-diagnose. Your vet will identify treatable causes. Open a direct CBD conversation. Mention the new mobility study. Provide all meds, supplements, and special diets to check for interactions. Choose products with batch-specific third-party COAs, confirming CBD content and THC-free status. Follow dosing precisely. Start low and go slow with close observation. Track stairs, jumping, activity, mood, and stop if side effects like lethargy or digestive upset appear.